It has been estimated that 1 in 3 Americans uses at least one over-the-counter medication regularly, and often without consulting a doctor. And studies show that 5 to 10% of all adverse drug reactions involve the cardiovascular system. This isn't just a matter of minor discomfort. These effects can range from increased blood pressure and arrhythmias to more serious complications like heart failure. Popping a pill for a headache or allergy may seem harmless enough. But behind this instant relief, some widely available over-the-counter medications pose a serious threat to your heart. For example, number 1. Contraceptives. Certain types of contraceptives, particularly combined oral contraceptives containing estrogen and progestin, can potentially increase the risk of certain cardiovascular issues. In fact, a 2020 study published in the Journal of the American Heart Association found that women using combined oral contraceptives had a 10 to 20% higher risk of developing high blood pressure compared to those using non-hormonal methods. Apart from arterial issues, oral contraceptives can also increase the risk of venous thrombosis, where blood clots form in the veins, especially for women who smoke and are over 35. Women with existing cardiovascular issues like high blood pressure or a history of blood clots are at a higher risk of complications from oral contraceptives. Remember, it's essential to consult a healthcare professional to discuss your individual health and determine the most suitable contraceptive method for you. Number 2. Nasal decongestants. Over-the-counter decongestants like pseudoephedrine offer quick relief by shrinking swollen blood vessels in your nasal passages. These medications act like stimulants, causing blood vessels to narrow. While this can shrink swollen nasal tissues and give you relief, it can also have the unwanted effect of raising your blood pressure. This can be particularly dangerous for people with existing hypertension, putting additional strain on their cardiovascular system. These decongestants may also speed up your heart rate. This can be problematic for individuals with heart conditions or arrhythmias, potentially worsening their symptoms. So rather than going for decongestants, consider using saline nasal sprays. These gentle solutions help clear mucus and alleviate congestion without affecting your heart. You can also consider steam inhalation. Humidifying the air can loosen mucus and ease congestion naturally. And most importantly, always discuss your specific health condition and potential risks before using any decongestant medication. Number 3. Tricyclic antidepressants. Tricyclic antidepressants, or TCAs for short, have long been used in managing depression, but their story goes beyond that single application. They've also shown effectiveness in treating anxiety disorders, chronic pain, and even nocturnal enuresis, also known as bedwetting. A recent study has raised concerns about the cardiovascular risks associated with TCAs. It found that a staggering 98.7% of patients taking low-dose TCAs experienced a significant increase in the risk of major adverse cardiovascular events, such as heart attacks or strokes. Amitriptyline, nortriptyline, and imipramine are among the most commonly prescribed TCAs. While effective in treating depression, they can potentially disrupt the heart's electrical signals, leading to serious arrhythmias, especially in individuals with pre-existing heart conditions. Discuss your full medical history, including any pre-existing heart conditions, before starting TCA treatment. Plus, if TCAs are necessary, regular monitoring of your heart rhythm and overall health is essential. Number 4. Weight loss supplements. Some drugs like citrine were once touted for weight loss, but they've since been linked to a higher risk of heart attacks and strokes. In fact, a 2021 study shows that citrine use was associated with a 23% increased risk of heart attacks and strokes. This means these medications should only be prescribed very carefully and only to certain patients. For example, sibutramine is a powerful medication meant for severe obesity cases. Taking it without a doctor's advice can be dangerous. Another example is Saxenda. Studies show that this weight loss drug can increase heart rate by about 3 beats per minute. This likely ties to its effect on how your body burns fat. Be aware of this potential side effect and monitor your heart rate during treatment. And don't hesitate to discuss any concerns with your doctor and work together to find a safe and effective weight loss plan that suits your needs. Number 5. NSAIDs. Over-the-counter pain relievers like ibuprofen and diclofenac, known collectively as non-steroidal anti-inflammatory drugs, offer quick relief from aches and pains. But long-term or high-dose use of NSAIDs may pose a risk to your heart health. Firstly, NSAIDs can elevate blood pressure, putting additional strain on your heart and arteries. Secondly, they can lead to fluid retention, further contributing to high blood pressure and stressing the heart. NSAIDs can affect platelet function too, potentially increasing the risk of blood clots that could trigger a heart attack or stroke. In fact, a 2018 study shows that short-term use of prescription NSAIDs in healthy adults led to a 48% higher risk of heart attack or stroke compared to non-users. For heart patients, a 2020 study observed a staggering 92% increase in the risk of myocardial infarction or a heart attack. Therefore, if you have any pre-existing heart conditions, consult your doctor before taking NSAIDs, even if you are healthy. Long-term use of these medications without your doctor's supervision is unwise and can be potentially harmful to your heart health. Number 6. Neosaldina. Neosaldina, a common pain reliever used for headaches, menstrual cramps, and muscle aches, contains many beneficial ingredients to tackle pain. Two of these compounds are isometheptine and istine or phenylephrine. Both of these are vasoconstrictors, meaning they cause blood vessels to narrow. By narrowing blood vessels, these medications can potentially decrease blood flow to areas of inflammation, which can help to reduce pain and swelling. But as they narrow blood vessels, these medications can cause blood pressure to rise. This can be particularly dangerous for people with pre-existing hypertension or other cardiovascular conditions. A 2018 study published in the Journal of the American Heart Association shows that taking phenylephrine for just 1 week led to a 5 to 10 units rise in systolic blood pressure. So always consult your doctor before using Neosaldina, especially if you have any pre-existing health conditions. If you do use Neosaldina, use it only for the shortest duration possible and at the lowest effective dose. Number 7. Corticosteroids. Corticosteroids, often simply called steroids, are potent medications used to combat inflammation and suppress the immune system. They offer relief in a wide range of conditions, from allergies and asthma to autoimmune diseases and joint pain. But their overdosage or long-term use can raise blood pressure and cause fluid retention, putting strain on the heart and increasing the risk of congestive heart failure, especially in pre-existing cases. Their long-term use can also disrupt metabolism, leading to high glucose levels, electrolyte imbalances, and higher cholesterol and triglyceride levels, all significantly increasing the risk of future heart disease even in healthy individuals. High doses can disrupt your heart's rhythm, leading to cardiac arrhythmias. In fact, some studies show that this affects up to 82% of users, and these irregularities can often be serious and require medical attention. Always follow the recommendations from your doctor on dosage and duration of these medications. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.